Medicaid and the budget bill. As you know, Trump signed the One Big Beautiful Bill Act on July 3rd, making this budget reconciliation bill a law. So I'm going to tell you right now, I've tried to do this video on Medicaid several times. I can't get it done. I can't even get it done in 20 minutes. There's too much. So this first video, today's July 6th, this is going to be about Medicaid expansion cost sharing, as well as expansion coverage information. And anybody who's on Medicaid should watch this video. But if you have ACA expansion coverage, you need to watch every Medicaid video because there might be some information in those videos that relate to you as well. I'm going to do at least 2 to 3 videos today, July 6th, but just stay tuned and be patient. There's a lot of information, okay? Number one, it's really important that you save this video so that you have that information to look back on. Share it so that other people can also obtain this information so they're not going crazy with wondering what the heck this or that means with this insane bill, okay? It's also really important for you to know that what is covered by your Medicaid will vary state to state, okay? The One Big Beautiful Bill Act has federal policies, regulations, laws, provisions, amendments that apply to all states, but ultimately states will decide what exactly is Medicaid will cover and what it won't and where, because states are going to receive a lot less funding from the federal government. So states will have to decide to make up that funding, maybe raise taxes within their states or finagle money here and there and put more money into Medicaid, etc. States will decide what to do. So it's going to vary state to state, okay? First topic, Medicaid expansion cost sharing. The effective start date for cost sharing for those in the Medicaid expansion programs is October 1st, 2028. So you have a lot of time before this goes into effect. Number one, enrollment fees or premiums for expansion will be eliminated. Also, states will be required to impose cost sharing of up to $35 per service on expansion adults with incomes 100 to 138% FPL. FPL is the federal poverty level. I will share screenshots of, I have 6 screenshots I will share at the end of this video that I also got from hhs.gov. That show the federal poverty level guidelines, so you can easily figure out if your income falls between 100 and 138%, and then you know whether or not you're going to have that cost sharing copay as an expansion adult. Next, services exempt from cost sharing fees for expansion adults: primary care, mental health, substance use disorder services, services provided by federally qualified health centers, behavioral health centers, and rural health centers. Only those federally qualified following the federal laws. Emergency family planning, pregnancy, and preventative services are all also exempt from cost sharing charges. This bill also maintains the 5% of family income cap on out-of-pocket costs as well. Expansion coverage. There are 41 states who offer ACA expansion, Medicaid expansion coverage, as well as Washington, D.C. That will not change. There are no new provisions for expansion coverage. The Affordable Care Act expands Medicaid eligibility to non-elderly adults with incomes up to 138% of the federal poverty level, which is FPL. You can check out to see if you're eligible for the Affordable Care Act by looking at the screenshots I'll provide you at the end of this video. If your modified gross income does not exceed 138% of the FPL, then you qualify for expansion coverage. Now, also the Affordable Care Act provides 90% federal financing for the expansion population. So there aren't really any changes with that. Now, that is all the information on cost sharing for expansion adults, as well as the fact that there aren't any changes as far as expansion coverage for ACA, okay? All the other Medicaid videos that I'm doing, you will find, if you are part of the expansion program, you will find information that relates to you in those videos as well. I've got to do it kind of topic by topic because there's so much information. Okay, if you have any questions about this video, or if there's something that you want to know about specifically, drop it in the comments, message me, what have you. I appreciate you being here, but please like, follow, and share so that I can continue to provide you with content. And it's really important to get this information out as accurate as possible. The next 6 screenshots are from hhs.gov. It's the Federal Poverty Level Guidelines. Super easy to figure out. You look at your household number on the left. If you are just a single adult, that's one person in your household. And then you scroll over to the different percentages. If you want to know if your income is up to 138%, you can look at the number underneath that column. It's pretty self-explanatory. But thank you for being here.